Hello everyone, my name is Ubuchi Became Gosgift. I'm team leader project Let's Talk Health. This project is actually very personal to me because I actually grew up with a dad as schizophrenic and a sister that actually suffered from bipolar disorder. And I believe that's why I chose medicine as a career. And that's why I'm doing this project.
Hi, my name is Ujabo Chineye and I am the team lead of follow-up of Project Let's Talk Health. And I'm a part of this because I am very passionate about mental health since I suffer from anxiety and depression.
Hello everyone, my name is Olaide Sheraton. I'm the head of content and editing at Let's Talk Health, and I suffer from depression and anxiety, which has led me to pick an interest in the project as well as many opportunities that it could offer to many others like me.
Hi, I'm Kai Gotspa AJ, Head of Policy and Department at Let's Talk Health. Growing up with my cousins, some suffered from substance abuse and alcoholism, and we lost a brother to that. Let's Talk Health gave me the opportunity to help out people like that, help share my story.
Hi, my name is Mzuzah Michael, and I am the Article and Research Officer of Let's Talk Health Project, and also an advocate of mental health, having experienced firsthand just how much mental health can affect one's personality and productivity. I have struggled with depression for the past couple of years, and it's been really hard. Story behind the concept. Years by years, many individuals have been forced to hold back their cries in silence, alone, some in stigma, some crippled by their unraveling thoughts, by society, by the inability to fit in, some by family, some due to the unrealistic life that social media presents, some by spiritual and stereotypic beliefs. But is it worth the silence though? We believe there's no better time to learn, to unlearn, to relearn, to speak, to hear, and to be heard. So together, let's talk health.
Imagine an ideal environment, imagine an ideal society, imagine an ideal community where young people in the environment can actually live freely, understand, interact, and reach their full potential. Imagine an ideal situation and an ideal society where it's okay to not be okay. But unfortunately, that is not what we have. Do you know that according to the World Health Organization, Nigeria is ranked the 30th most common country with suicide case? You also know that one out of every four Nigerians suffer from a mental health issue in their lifetime. That is to see Nigeria with over 200 million people in terms of population, no less than 50 million people who have suffered from a mental health issue. That's actually very bad statistics. And not just that. Out of these people that will suffer from mental health issue, just less than 10% of them will actually get the required mental health services and mental health care that they need. Yes, truly, that's why Project Let's Talk Health is here to offer solutions to mental health stereotypes, to mental health awareness, to mental health negligence, to create a better environment and a better community for everyone to thrive.
We're solving problem of mental health negligence through mental health awareness. We're debunking superstitious beliefs and stereotypes by sharing our personal stories relating to mental health and how we combat mental health illnesses. The innovative solutions are in two phases, an online and offline phase running simultaneously to help the platform. The online phase consists of the Let's Talk Health website. Now this is going to contain videos, articles, scenarios, stories, different materials showing the information about mental health, the stories relating to people who suffered from these mental health illnesses, how they passed through them, and also what you can do if you have a relative going through this kind of crisis. The Let's Talk Health application will also contain everything in terms of this website and a lot more. Imagine assessing a mental health expert, imagine assessing a doctor by just a click of a button. The online innovative solutions also consists of social media awareness and social media campaign. This has been run via the Moment on WhatsApp and Telegram platforms, daily posts on Instagram and Twitter concerning mental health tips, and how to battle mental health crisis and mental health situations. Surveys are created in conjunction with the Moment. Pre-Moment survey takes the basic data, basic knowledge that the community has about mental health. We get what you know already about your mental health. You get your symptoms and how you feel about mental health. then these are brought into the discussion where the experts trash out all gray areas and help you see what you can actually do, what can be done to combat your mental health illnesses. They educate and also treat, prescribe, and refer solutions to these mental health issues. And after the discussion, post-moment survey is created. Now, this is to examine how well you've gained from the discussion, to know the new areas where you can help yourself and help people around you, and also to know how much you understood about your mental health and your mental health application of that knowledge. The offline solutions run in conjunction with the online solutions, and the offline solution consists of mental health campaigns, rallies, and conferences. Here we massively go out to educate the public in secondary schools, universities, and conferences for workers and also mental health practitioners out there. You get to know the basis of mental health application, mental health illnesses, and mental health solution, as well as administration of the relief materials and helps to those who are suffering from mental health problems. We also, like we partner with Show a Child projects. Those are ways we help to the less privileged and also those who don't have direct access to this information by training their mental health, they are training their health staffs and also those who work with the children directly to enable them know how to handle the mental health of the young ones. These solutions can only work together via our sustainability plans to help the project gain its relevance.
Let's talk health. Our stakeholders include everybody that is going to be affected by the outcomes of our project. They include our beneficiaries and our local partners. For our beneficiaries, we have our primary beneficiaries and secondary beneficiaries, which you could also refer to as our direct and indirect beneficiaries. For our primary beneficiaries, they include secondary school students. We plan on visiting about 7 secondary schools and reaching out to about 500 students, totaling to 3,500 students in the secondary schools across the nation. We also plan to reach out to about 10,000 students in the University of Abuja, and in the long run, we plan to reach the same number in different universities across the nation. For our local partners, we plan on partnering with a range of individuals and government agencies, which include mental health experts, which consist of psychologists, therapists, and clinical psychiatrists. We also plan to partner with non-governmental organizations such as Mentally Aware Nigeria, Next Gen, and Show a Child organization. We plan on partnering with government institutions as well, like the National Orientation Agency, which will help us in spreading awareness even in the rural communities. And we also plan on reaching out to private industries such as health and wellness companies. Finally, we also plan to partner with private organizations such as pharmaceutical companies and health and wellness companies.
Let's talk health. Our scope definition talks about creating a platform where young people can learn, relearn, and unlearn about mental health. We're also looking to create a good statement such that we're looking to create awareness for mental health, creating a safe space where mental health issues can be discussed without fear or stigma. We're also looking to interact and create an opportunity where the general public can interact with mental health experts through our website and application. Also, we're also looking to increase and provide opportunity for community awareness on mental health issues and mental health disorders. Not just that, we're looking to create a general environment where Nigerians can reach and achieve their full potential. For technical and quality specification, we're looking to categorize our project in phases. The first phase talks about the first 6 months of the project, where we engage in community mental health outreach, university mental health campaign, and secondary school mental health campaigns for 6 months. The second phase of the project talks about engaging in most similar activities, both online and offline. University mental health campaign at the University of Abuja permanent site, the secondary school outreach, which involves 7 secondary schools, like was mentioned in our partnership and beneficiaries, as well as the online phases of the competition and the project. We're also looking to improve our services by creating a 20% subsidy for mental health, which we incorporated alongside our plans to work with insurance companies and insurance scheme through using a telemedicine approach. Yes, but Let's Talk Health will be implemented in 18 months. That's what we have to offer. That's what we have to do.
Let's talk health. Like any project, it's required that you have a sustainability plan in check. And so far, we've been able to sustain ourselves financially by participating in trainings, and we've been able to get some percentages from those trainings. And we've partnered with some organizations where we've gotten a certain percentage from the partnership with these. Moving forward, we plan on sustaining this project financially and structurally. Financially, through our Let's Talk Health website, we would run sponsored posts and advertisements where we can get a certain percentage of money. Also, we plan on partnering with mental health experts where we would work with them and would gain a certain percentage of money from them working with us by helping people that we reach out to through our website. Also, we have fundraising programs. This would happen by people getting a chance to buy magazines, shirts, tote bags, all products from Let's Talk Health. Everyone would want to buy these things. Then we have the insurance cover, which would be attained by our partnership with insurance companies such as NHIS, that's the National Health Insurance Scheme. Structurally, we plan on establishing mental health clubs here in the University of Abuja alongside partnership with the student union governments. Students would want to participate this way because they can see a known force that would enable this to
Actually,
happen.
taking a robust approach in terms of seeking for donor grants and funding, because we know that if we make mental health services available, foreign organizations and agencies will be interested in mental health, and with that we can actually fund our projects. Not just that, we're also looking to get free donations and also able to work with pharmaceutical companies, other companies that are interested in mental health, advertise their products, and an aspect of it are going to the project funding. We believe that Let's Talk Health is for all, and that's what we're talking about, increasing person to person and personal mental health investment. We want to provide an opportunity and an environment where mental health and health talks can be a thing in our country and our society at large. We're also looking to tell people and encourage people to engage more in the personal mental health, which is of great necessity, because you cannot fix the environment, fix society without fixing the people. Project Let's Talk Health is actually a work in progress. So far, we've been able to keep the project running in our little capacity. We're looking to use this opportunity to create a much more robust approach in talking about mental health and providing mental health services for all. So far, we have the Moment running, which is a 2 hours worth of discussion where people get to share, talk about what bothers them, and learn. We learn and we learn about mental health and mental health illnesses and how to help the loved ones. We also have our campaigns running. August, we're able to run this What's Inside campaign, the Light a Candle campaign. We've also been able to engage in training for projects, the Child training, which we were able to offer, and therapy on the escalation of orphanage staff to help the kids. We've also been able to engage in expert talk, where we invite mental health experts and professionals to come and talk about specific mental health topics and give expert approach on how to handle them. Not just that, we're able to keep the project running, show project administration, project movement, and a whole lot more. I believe this opportunity and Mzuzah will actually give us a chance to actually express ourselves more, reach out to more audience, reach out to more people, young and old, just to ensure that mental health is something that is made relevant, just to ensure that mental health negligence is no more in our community. We want a better community for all. We believe that there's no better way to fix the community than to fix the people. That's why we're talking about Let's Talk Health. That's why we're talking about Project Let's Talk Health. We believe that you and I, we all matter. Thank you.